Great, thanks a lot. So my name is Johanna Scholz. I'm an MPA student here at the Hertie School, and I'm very happy to welcome you tonight to our event, Loneliness, a Silent Pandemic. Before we go into the topic of tonight's event, I want to make two remarks though. We will record the panel for some time. We have checked that none of you are actually in the filming, at least if you're not coming up on stage. And the Q&A will also not be recorded. So your questions and the discussion later will just be among us. The second point is that the event is a team event tonight by the Work Economy and Social Policy Club, WESP here at Hertie. So next to myself, we also have our club president, Christine, here in the back, which will be running around taking photos. Then we have Jan here in the front, who will be our moderator on stage later, and Camille handing the technical equipment. So thanks a lot for this team effort. The WESP Club organizes panel events like these around economic and social policy topics, but we also really care about basically supporting students in their learning journey. So you might have seen our other formats like Thesis in a Cup, where you can get peer support and feedback on your thesis. And if these topics are interesting to you, we are welcome to join us. Just come up to us or send us a message. We're always happy to see new faces. But now, coming to the topic of tonight's discussion, loneliness. How many of you are Hertie students, actually? Okay, basically all of you. How many of you have relocated to Berlin for your studies? Okay, that's most. So have experienced the Berlin winter here? Right. So I believe many of you can actually relate to feeling lonely from time to time, not just because of the weather in Berlin, but things in a new country run differently. So while some of this is really exciting, when you struggle with your exams, your Anmeldung, your visa process, you would probably be happy to have a friend patting you on the back and telling you it's going to be okay. Or while you were sitting in your room or in your apartment back then during COVID-19, facing social restrictions and really miss being able to connect with family and friends. We probably all spent some more time online, connecting with people on Zoom or social media. And a fair amount of people even got pets. But probably all of these connections didn't feel just as the same as human interactions in real life. So now you might think, all right, this is something we all struggle with from time to time, right? We feel lonely, we've been through this with COVID. Why does this matter to societies and also to policymakers? Why should we care so much about individual well-being? And I'm happy that tonight, I think we couldn't have found a better panel and also a better speaker for our first input on exactly outlining why this is the case and why individual and societal consequences of loneliness really matter. And so I want to welcome our first speaker tonight on stage, which is Lara. Lara Fleischer is the acting head of the team on Wellbeing Data Insights and Policy at the OECD, specifically at the WISE Center, which is the Center for Wellbeing, Inclusion, Sustainability, and Equal Opportunity. In her role, she leads the OECD's efforts to improve countries' performance on well-being, with her work specifically focusing on social connectedness and mental health. Prior to joining the OECD, Lara spent several years in Kenya and Sierra Leone, applying behavioral insights also to emerging economy contexts. She holds an MPhil in development studies from the University of Oxford. So Lara, please come up on stage. It's yours.
Great. Hi, everyone. It's wonderful to be here tonight, and thank you very much to the Work Economy and Social Policy Club for organizing this event. I will start by giving you a very high-level overview about why social connectedness matters, drawing on some international evidence. But because this is a social connectedness event, I actually want to take 30 seconds for each of you to turn to someone around you that you don't know yet, introduce yourself and say hi. We'll take 30 seconds for this. Okay, I think I'm so surprised how much you're chatting. Actually, this is great, but there'll be more opportunities after this talk. Great. So, as already mentioned, I work at the OECD, and as many of you may know, we are an international think tank that brings together advanced and democratic economies to learn from each other. And my team at the OECD in the WISE Center, our role is to move our member countries towards prioritizing the well-being of people, the planet, and future generations in policymaking, as opposed to pursuing or maximizing the current existing economic growth model. We do that in a variety of ways, and if you're interested in that, you can find me at the informal drinks afterwards. But for the purpose of today, I just want to highlight that social connectedness has always been a core part of our definition of well-being since we launched this work more than a decade ago. But now I'm really excited there's finally some movement and momentum, and governments are really recognizing the importance of social connections too. So even 5 years ago, when we would bring this up to policymakers, they would step back and say social connections, that's people's private lives. This is something we don't want to interfere in. And the situation today, also thanks to our experience of COVID, is really very different. So if there's 3 key messages I want you all to take home after my presentation, they are on the slide. One is that social connectedness is really multifaceted. We're often talking about loneliness, but it's actually about much more than that. And social connectedness has very significant implications for health, economic, and also democratic outcomes. The second key message is that actually we don't have very much high quality, internationally comparable and long-term data on social connectedness, but the data that we do have suggests some really concerning trends, especially for youth. And then third is that social connectedness is really not just a personal topic. This is policy relevant, and it's governments and the society at large that can create the structures that can promote or hinder the way we can connect with each other. So this is good news because this means this is policy amendable. Policy can do something about this. But we also still need to gather much more evidence on what works, particularly for interventions that focus on communities at large rather than only on disconnected individuals. So I want to start with a short definition of some key terms. There's multiple theoretical frameworks on social connectedness that I'm not going to go in depth here. But what is important is that social connections capture both the objective quantity and the subjective quality of the time that we spend with others. And 2 of the most common terms that are used and that are actually often confused are here. Social isolation, on the one hand, that refers to objectively having very little contact with other people. And what the definition of, what is very little contact varies. For example, I think the French Statistical Institute considers someone socially isolated if they have contact with friends and family only once a month, which I think is actually a very low bar. And then loneliness, on the other hand, is a subjective feeling. So where the connections that you desire to have are not matching up with the actual connections you have in your life. So you can feel lonely even among a group of friends or in a crowded room, which I think many of us have felt at some point in our lives. It's really, really important to distinguish between those 2 terms because the policy response is actually likely to be very different if you're thinking about helping someone, for example, in a remote rural area have more opportunities for meeting other people versus helping someone who already has contact with a lot of people forming more meaningful connections. And then lastly, we can also distinguish between connections between individuals and the connection between an individual and society at large, so a feeling of belonging to community or society. And just to show you why clearly defining what we mean with social connections matters, there's some results from a study in 2022 that we conducted in 12 OECD countries, and where we asked 3 different questions on subjective social connectedness. So whether a person feels lonely, whether they have a great social support network, or whether they have special people with whom they are close. And you can see that the preferences or the levels of each are actually not very highly correlated, and you end up with completely different country rankings. For example, especially at the 2 ends here of the distribution, Turkey and Japan, which means there also needs to be a lot more work on developing really robust metrics on social connections that are applicable across different cultural contexts. That's something we are looking into doing potentially next year. So why do we care about social connectedness apart from the intrinsic value for individual well-being? It turns out they are really important for many other societal outcomes that we care about. For instance, our physical and mental health. And in fact, many of the kind of government strategies on social connectedness are often led by health ministries. Not always, but often. So not in Germany, for example. So humans are social creatures, and research has consistently shown that when we are socially isolated or feeling lonely, this means we have to spend more energy to stay vigilant. And this can trigger some of the same neurobiological processes that, for example, a physical threat or fear can induce. So all of this is then associated with higher resting heart rate, higher stress and cortisol levels, and disrupted sleep patterns. And then we're also less likely to engage in health protecting behaviors such as physical exercise, especially if you have no one to go with. So all in all, social isolation and loneliness can then lead to a higher risk of blood pressure, heart disease, obesity, anxiety, depression, dementia, and overall increases the risk of premature death by up to 30%. And there's this one famous statistic that many of you might have heard of that then is equivalent to smoking 15 cigarettes a day. So we can really speak about a public health concern here. But there's even further implications beyond that. The first is that there's really large economic costs to loneliness. So to individuals themselves, so social isolation is associated with lower academic achievement and worse performance at work. And then society at large, if you consider the large economic costs from higher healthcare spending, as well as costs to employers who are facing absenteeism and lower productivity that can be attributed to loneliness. The estimates of the overall costs that exist really vary according to the method used and the country, but some conservative ones have placed it at around 1.2% of GDP annually in terms of costs. Secondly, we know that socially connected communities are safer, they have lower levels of crime, and they're much more resilient when it comes to facing disasters. So during COVID, we've seen that socially connected communities saw much better adherence to COVID restrictions, and they have also better outcomes after a natural disaster where you really need your neighbors to help you. And this will be much more important considering climate change going forward. And third, this is not shown on the slide, but I think we'll hear about this in the panel. There is some emerging evidence from the US, but also from Germany, that suggests that feeling lonely can lead to adopting more extremist political views and also a lower likelihood to vote. So there's really important implications for our democracy here too. We should all care about this as a society. So what do we know about how social connections have developed over the long term? So up until the pandemic, the data we have on social connections is objective and mostly comes from time use surveys. So we are talking about the actual time that people are spending in social interactions. So on the left, if we zoom in on this red circle, we see the actual time that people are spending in social interactions. And on average, people in OECD countries in 2018 interacted 6 hours per week with friends and family. This is the definition is a primary activity. So this means you really meet up with someone with the objective of hanging out. It doesn't count that you cook and your family is in the background. That is not the primary activity. What's more important here are the few orange dots. So those represent the countries for which we do have long-term data from 2010. And orange means there has been a deterioration. So on average, social connections with friends and family has decreased by around 30 minutes a week between 2010 and 2018. And then if we zoom in on one country in particular, the US on the right, this is a country that has really good time use data. We see that in the 2 decades between 2000 and 2020, the minutes that people spend in a range of different social activities have all been on a downwards trend. So the COVID pandemic has really marked a turning point in multiple ways, in that for the first time we've seen really an explosion really in the data on more subjective measures of social connectedness, but in particular loneliness, being connected. And that data has shown that there has really been a sharp rise in loneliness prevalence during the social lockdowns we faced during COVID. So for European countries, by March 2021, 1 in 5 people said they felt lonely most or all of the time, which was more than triple the prevalence compared to 2016. And what's really interesting is, if we look at this bar chart, is to see, well, who felt the most lonely during that time. We see that in particular, younger people, the unemployed, people that have financial difficulties in making ends meet, and people living alone felt the most lonely during the pandemic. So in many cases, groups that already face some sort of social disadvantage in one case or the other. We don't have data on race and ethnic identity collected in this study, but data from other studies shows that there's also really large gaps here in terms of feeling lonely. For the most part, these social gradients have already existed before COVID. So many of those disadvantaged groups have felt lonely before, except when it comes to age. So this is the kind of flip we have seen, where we have seen a sharp rise in youth loneliness during COVID. I must say that the long-term trends on youth loneliness are a bit debated, and the evidence here is mixed, whether it has really, over the last 40 years, risen or not. Then if we look at more recent data, we still see elevated estimates for the population at large and for specific age groups. So we have not recovered to pre-COVID levels by now. In 2020, around 13% of people in European countries still felt lonely most or all of the time, with the highest prevalence for young people. And that was also, this age pattern was also confirmed by, this time, a global study carried out in 2022 by Meta and Gallup World Poll. All of this being said, coming back to the definitions that we talked about before, so young people are more likely to feel lonely, but older people remain the age group to be more likely to be socially isolated. So one really great development that I alluded to is that now governments have really started to recognize loneliness and social connection as a policy priority. And we have seen many initiatives spring up across countries, which is really exciting. And the World Health Organization has also launched a global commission on social connection in November last year. I'm on this, or my team is on this as an observer. And I know we're going to hear about the German strategy in more detail on the panel, so I won't go into much detail here, but I want to stress that all the different initiatives here are somewhat taking slightly different approaches, just because this is a really new field. So for example, the UK and Japan have become quite famous by creating Minister of Loneliness positions. That obviously doesn't mean that a whole new ministry has been created. This is not a ministry in the traditional sense, but it's a role, a really focal role within government that brings attention to the issue and that really allows to galvanize and coordinate cross-government action across that. And then in the Netherlands, the Ministry of Health, Welfare and Sport is, for example, much more focusing on supporting municipalities themselves, so local action in tackling loneliness. And they're not really funding them, but they're much more acting as a capacity building and peer learning and evaluation partner between those municipalities. And the US is another interesting example where the Surgeon General, Vivek Murthy, who's actually personally a huge advocate for this topic. He wrote a book about this in between his time as Surgeon General under Obama, now again under Biden. He launched an advisory in May 2023, but this is much more a high-level agenda-setting document that sets out what can all the different parts of government do without actually placing an obligation on them to do anything about it. So if we ask ourselves what policy can do best to promote social connectedness, I want to make the case that it's really, really important to stress that this is not merely a personal issue, but very much a structural one. So the opportunities for individuals to be connected are shaped by the social infrastructure that they find themselves in, the communities in which they're living, working, and growing up and growing old. So this includes the built environment, such as libraries and parks, available programs, community and volunteering programs in their neighborhoods, but also transport and housing policies. And all of those, in turn, are influenced by much broader social policies, income inequality, cultural norms, including the absence or presence of discrimination, the political environment, and macroeconomic factors. So if we want to go to the root causes of disconnection, we also have to take those structural factors into account rather than only giving, for example, a lonely individual mental health support to address so-called maladaptive social behaviors, although that's also an important piece of the puzzle. This is also relevant from a cost perspective because it might be more effective to focus on community connectedness rather than only on the individuals that are most isolated at the bottom and where it takes a lot of resources to pull them up. The evidence base overall on what works to decrease loneliness, especially long-term, is actually still being built. So we're all kind of learning as we're going, because this is a topic where we have gained political momentum without the evidence fully being there. That being said, there's almost new evidence coming out every day, so this evidence base is being built quite rapidly. What's available so far often focuses on older people and not yet on this new emerging risk group of youth. And the strategy, for example, to build a hotline that seniors can call will be very different than helping students to connect with one another. And it really focuses more on the individual rather than on those community level interventions. And this is my last slide. I just wanted to give you some brief illustrative examples on what this broader view on social connection promotion might look like. So one is to invest into this social infrastructure that I mentioned. And obviously that might involve urban planning with social cohesion in mind. But another interesting approach that can boost social infrastructure is called social prescribing, which has originated in the UK but has sprung up across countries many other countries since then. And it works in the sense that a doctor will refer a patient that presents to them to a link worker, who then in turn connects that person with community organizations that can help address the social determinants of health. And in the cases where those social determinants might be loneliness, that then could, for example, mean participation in a gardening group or a walking club or an arts class. And for me, this is a really interesting model because it might mean that we can funnel funding from the healthcare sector and from insurances to those community organizations that are providing those services, which can then in turn build up the overall social infrastructure that can serve many more people in the community. So it's really a kind of cost-shifting model. A second recommendation is to take social connectedness into account in other seemingly unrelated policies to create co-benefits, or at the minimum, don't do harm. So, for instance, Wales has, I think, in 2021 released a new circular economy strategy. And you might think that, yes, so the primary goal of a circular economy strategy will be to, improve the recycling rate as the only goal. But what they did was to look at how can we achieve this goal while also improving other well-being outcomes at the same time. So now, for instance, as part of that strategy, they decided to open small recycling and upscaling shops in all neighborhoods to also promote local small businesses and create new social spaces for people to meet. So you really have a green transition strategy that also catches two other policy goals at the same time, one of them being social connectedness. I will leave it here, looking at the time. you can find some resources here. Find me later at the panel, at the drinks, not on the panel. And with that, I think I hand over to the panel.
Well, the microphones are obviously on. So yeah, thank you very, very much, Lara, for these fantastic insights. I think that's the perfect start, the foundation for our discussion that we have right now. And first, I'd like to introduce all of the speakers. So Dr. Helen Maggis is a policy advisor at the Family Ministry, so that very ministry which had started the strategy recently. And she has a diverse background, so she studied social work first in her bachelor's, and after that gerontology, which, if I understood it correctly, is the science of aging. I had to Google that, probably many know it. And then also has a PhD from Charité. Perfect. Thank you very much for being here.
Yeah, thank you for invitation.
Sure. Melanie Weiser is a junior project manager at Das Progressive Zentrum, and they're the division Resilient Democracy, and very engaged in its work with the topic loneliness. And to all Hertie students here, she's currently in her professional year, so that's the kind of interesting stuff that you can do. Thanks for being here. Also holds a bachelor in politics, administration, and international relations from Zeppelin University. And last but not least, Melanie Eckert co-founded and is the co-CEO of an NGO called Krisenchat, which does psychological counseling to young people in crises, and has a background in psychology. Thank you very much for being here. All right, so after having had this very large-scale international perspective and so on, I'd first like to go a step back. Let's look at the individual problem again, because loneliness, of course, has social consequences, but is in itself an individual feeling and so on. So, Melanie Eckert, you have founded an organization, as said, which deals very much with people in mental crises, especially young people. And my question really is, what do you do there, and what does it have to do with loneliness?
Thank you so much. So what do we do at Krisenchat? We are 24/7, very low threshold psychosocial counseling service, and we do counseling via WhatsApp, SMS, chat formats with professional psychologists, but also social worker up to an age of 25. And we founded during the Corona time, and when we realized, okay, there are so many young people outside who maybe feel lonely, isolated, but also have crisis moments, and there was no existing infrastructure where they could really get to professional help 24/7. And when we started, it was quite a journey, because we thought, okay, we are doing this during Corona, and then it will change again. And we stepped really into a huge hole in the existing health and youth care system for very, very low barrier help for young people. And of course, we do not have a definition of crisis. We really take every crisis, no matter if it's like being lovesick, or is it serious like suicide thoughts, or depression thoughts, or anxiety. So at Krisenchat, everyone is welcome to talk and to relate to a professional helper. And I think this is a very big or a very important point when we talk about loneliness, because when we really emphasize on what does it mean feeling alone and lonely, this is really, really a hard struggling time for the individual. And it's very hard to get out. And it was very interesting, the presentation, how the barriers on an individual level rise when we are lonely for a long time. So it's very important that we have very easy access to help to get out of this hole when you experience long-term loneliness. And getting into a social interaction is, of course, like one very important step to get out of the loneliness circle. But many young people, and loneliness was a long time ago, not in combination thought by with young people, just old people were lonely. So this is quite new in the society. What really matters is someone who listens and who is there and gives a young person a hand and takes the thoughts and feelings very serious. And being heard, that someone is there who cares about the feeling, is often the first step out of their loneliness, because then the help seeker makes the experience, there is someone who relates to me and who cares about my feelings and my thoughts. And then often there's an interaction possible, like a door opens up, like in a personal door opens up, and the help seeker can develop with a professional together a solution for maybe making an appointment with a friend or going out, starting to move again. So the steps out of loneliness are often very, very slow and small, but it's important that there is another person who actually cares. And to build this up in this own social system, of course, is a aim, but the way to this aim is often quite long. So we try to build up like a digital solution for making the first steps out of loneliness.
So now you spoke a lot about how making social connection, listen, can solve to cure in a way. But do you also observe with these young people that loneliness has been one of, or seems to be one of the reasons in the first place why they feel the need to call you?
Yeah, quite often. And loneliness comes very often together with social anxieties or depression. So the comorbidity is very high. So loneliness is very often a side topic, sometimes the main topic. So it's quite often that we talk in our chats about it. And we are quite presented on social media and gaming platforms as well. For example, we have a Twitch stream with young male psychologists who do streams and talk about games, sometimes about mental health topics, sometimes not. Sometimes it's about the new release of a song from a rapper. And there we also try to get into a community which stays a lot online, on Twitch, gaming, and maybe is not even aware of the feeling alone and loneliness. So we try to go different ways to reach young people with this topic.
Has the situation significantly changed since COVID? So I suppose you started the whole NGO during that time, and I suppose demand was really high, and what I've heard definitely was. How are levels now?
It's even higher. We don't have any comparison to before, so it's hard for us to say out of our data that it's changed. So we got more popular. For example, we did over 120,000 consultations in the last 3.5 years, and we have a demand which is still 40% over that what we can handle. And we have a team fully employed, 120 employees and 500 volunteer counselors. So you can imagine 24/7, there are at least 2, 3, 4, up to 7 counselors at the same time online. And we don't even make any advertisement. So it's just being present on social media and the peer-to-peer references via TikTok very often. We got peaks when someone makes a TikTok about about us and our consultations. So the demand is just huge. And I mean, we are one of several offerings, and I think it's so important, especially like structural development on the governmental side, to take this problem really serious and to have a broad approach for solving it.
We definitely very much will come to that later on. So, Melanie number 2, and you are working at a think tank, and then the division Resilient Democracy. So we got a bit of a hint in the before presentation that there might be a link, but so could you describe why work on loneliness in this sector?
Yes, I can explain a bit. We also started our project during COVID, when the focus of loneliness was, at least in the beginning, mostly on older people. As we heard in the previous presentation, we know by now that the people who felt most lonely during that time were young people. And for us, focusing on democracy in my department, young people are the future of our democracy. So when we were looking at the statistics, the numbers, we saw that young people, as often in politics, were overlooked in these numbers. And that's why we decided to start a project which focuses on young people, how young people experience loneliness, and with a wild guess, how loneliness might also affect democratic attitudes of young people. And our project found, like you said before, that many young people, more than 50% of young people in Germany, sometimes or always lack company, and that more than 25% of them didn't feel like they have a connection to any other person at all. Just like overall, we had 55% of young people who lacked company, which is a total number of around 3.6 million young people in Germany, which for me is a crazy large number. And we found in our study that there is a significant positive correlation between people who feel lonely and authoritarian attitudes of these people. So people that don't feel connected to their society have a higher risk of believing in, for example, conspiracy theories, of being in favor of political violence, of thinking that the government hides stuff from them. So it's not only concerning for our society, but also for our democracy if we don't address this topic. That's why since then we've been working on addressing this.
Yeah, that seems to make a lot of sense. Helen Meggers, if you heard the presentation before of what the general trends are on an international level, now hearing from a very individual level, more from the health perspective, but also from a political perspective, is there another issue that you would like to also add, in a sense, which you think is also very salient, with loneliness, of course?
Well, yes, I think I have one issue. I'm not sure if it really was already mentioned, but a little bit in the statement from Melanie from Chat. Yes, there. This is raising awareness on the topic to get it out of the taboo. This is one big goal of our strategy to counter loneliness, of the federal strategy to counter loneliness. I will talk about it later, I think. But this raising awareness is really very important. This is what we know also from lots of studies, that people feel afraid to talk about it. And this is, of course, very important. And then easy access to our services, as Melanie from Chat mentioned, is so important, that you go to the people where they are, like Twitch and things like this, that you offer the help there, and to talk about it. And also we are thinking that it's important to like for the whole society, and this was really a big change with Corona, that now people start to talk about loneliness, and this was a game changer, I would say. And also, as we heard from Lara before, yeah.
Definitely, that's also why we do the event in a way, right? And now moving a bit from more the problem analysis, in a sense, what's going wrong in a way, to understanding the causes. So, Melanie Eckert, your work focuses on young people, and we heard before, okay, during COVID, probably before we don't know so much, and loneliness is a topic which affects a lot of young people. And for many people, I talk about with that, this is really counterintuitive. I mean, they go to schools, usually have a lot of people surrounding them, but also live together with their families and so on. So what are the reasons? Why?
Oh, this is a complex question. I think there's so many reasons, especially why do young people feel lonely, and there's no easy answer. There are some tendency which make it for young people at the moment very, very hard. And these are, of course, a general situation on Earth. We are living in a time of crisis, and this is for many young people really a topic. And there's one very, very important, like normal developmental reason, which counts in as an environment in which a child gets born in, and how relatable and present the parents are in terms of not how many hours are they present there, more in terms of how really engaged are they with their children on an emotional level. Do they really interest themselves in what the child is experiencing, or how it's feeling. And so the early relationship between parents and children in a very complex world is one topic. And that's why I think we really need to engage children in psychosocial competences, also independent from where they were born and in which family and in which environment. Beginning in the kindergarten at its best, because we need these social, emotional competences to deal with a complex world. And that means that we have to deal with a lot of anxieties, with ungood feelings, with complex living situations. So we have to be, as a human being, very adaptable. And this is quite high-level competencies in terms of what a child needs to learn in the early ages. So I think also the digital developments are very important, and I think it's terrible that we still don't learn in school good media competences, really to develop a good knowledge in terms how much social media is good for me, when it's not good for me, what does it mean when I have many social media friends, is it being really social integrated or not. And so I think there are so many levels where loneliness can be one symptom of a very complex life system.
Definitely.
Thank you. As Melanie just said, it's very complicated, but one of our co-authors of the study we made, she has a very interesting, in my opinion, model where she says that loneliness comes in waves during your lifetime. And she says that in the beginning, people tend to be more lonely, and then there is a sort of decrease, and in the end, like when they get older, they tend to be more lonely again. And according to Michael Luhmann, this is because in these early stages of your life, as well as in the last stages of your life, there are many things happening, and you don't have much influence on what's happening around you. So as Melanie said, we have friends that are moving. Our whole situation is sort of based on what our parents decide for us, or in the end, our children decide for us, maybe. So when your friends move away, when you have to change school, when your parents separate, all of these things change basically your whole life as a young person. And so this is, according to Michael Luhmann, one reason that covers like all of these very, very complex individual issues young people have, and the reason why they tend to be more lonely.
ahead.
Yes, maybe only one point for the older people. You mentioned it already. Like what we know as typical reasons to enter loneliness is entering when you enter the phase after working, when you go into pension. I don't know, and this is also like a risk factor. And we do know several more risk factors as reasons for loneliness. Of course, the financial situation is in all of the studies. You can see it. It's a big factor. And the physical health state is also like when you're chronically ill. And this is, of course, happening especially to older people, but also young carers. Is like we have a project with young carers, and the project is called Pausentaster. We want to do more for them as well, but also all caregivers are in a high risk situation for loneliness. So there are some reasons and situations in life where it's more possible that you can enter or can have these feelings, and this is important to recognize.
What about community? So I have a book on my shelf, which I'm currently trying to read, which is called Bowling Alone. So some of you might have known from that. So bestseller, written I think like 2002, 2003 by Robert Putnam, Harvard sociologist and economist kind of. And what he describes there 20 years ago is like the decline of American community life. And he describes that, okay, sports groups, religious groups, political parties, and so on are losing members in rapid speed 20 years ago. And do these kind of developments also happen that's matter in Germany as well? And how does this relate to loneliness? Seems like something which could be connected with it, no? Does anyone want to go with it?
Definitely. I would say yes, because in every community you have one or two significant others who care about you and who ask you, are you coming to the training, or when do we see each other? So this is all about the connectiveness in the social communities, which got less, and this has an impact, definitely.
Yeah, and these communities tend to shrink. Sorry, because there is a difference between places where you have to do something, where you have to, for example, when you go to school, you have to be good in school, you have to participate because you get grades. Then there's other places where you have to pay to be there. For example, if you go to the cinema with your friends in the evening, then you have to pay to be there. These are called the first and second places. And then there are so-called third places, which are places where people don't have to do anything to just be there, like playgrounds, for example. And these places are shrinking. Like young people don't have these places anymore because society or organizations can't afford to provide them. And that's why young people don't have these opportunities to be like, hey, let's meet tonight at, I don't know, some place where we have a sofa and can just sit and chill. And so there is no one who's like, hey, when do I see you again? Will you be there? And this is a huge issue, which is also an issue we found in our study, because 60% of lonely people can name a place where they don't feel well. And this place is mostly school or university, but not all of them can name a place. Like 20% of them, I think, don't have a place where they do feel well. So this is definitely an issue.
Sorry, just want to add, and this is a huge chance for digital solutions, digital communities, and there is research also that digital communities, I just read an article about it, like Twitch, can have a very good impact on the mental health and status of someone when it's used like properly and not overused. But I think here we have huge opportunities also to create new communities with significant others where people feel really belonging to.
Yes, I also want to add like that there are programs from city building programs. We are also funding from the government, the Ministry of Clara Geiwitz, for example. She has several programs where we want to go into on the local level. And we know that communities are happening in the local level. We need more places where it's very easy to get in, for all age groups. Of course, this is very often difficult. And also for generations that they come together. We have, for example, this multi-generational homes. Also, this is another funding program, Mehrgenerationenhäuser in German. And the aim is to build up communities where it's very easy to meet each other, and for no reasons. You do not have like to do something there. That was also something you mentioned here before. And we have this knowledge and want to do more in this context to strengthen these communities again.
I see we're already kind of getting where we want to get. So what do we do, right? And I think, Helen Megas, you are really at the forefront of this now that you participated in a way actively definitely in shaping the strategy of the family ministry. And I suppose this is probably a good moment to present it and say what are the most important things that you want to do to tackle this issue.
Yes, thanks. Yeah, first of all, I need to really make a point that this strategy is a starting point. So we do not, this is what also Lara said, we need to know more knowledge on this topic. But let me tell you about it. So we started this elaboration process of the strategy to counter loneliness in June 2022, and then there was a broad participation process where we had like lots of discussions with civil society actors, with associations, with the science, and also with the states, because in the federal states of Germany there is also happening a lot of actions against loneliness. And therefore, we then ended up in a good strategy paper, I would say, and then discussed this in June last year, in 2023, with the other federal ministries. Because, of course, we heard it today, it's a topic, we have to act across sectors. It's such a broad topic, and it's affecting so many so many areas of the society, so we really need to think big there. And with the other ministries, as I said before, we are from the family ministry, and everybody thinks of the health ministry, of course, when it comes to loneliness. And the health ministry was kind of, that did not come so much from them. So Professor Lauterbach maybe is now focusing on the cannabis, legalized cannabis. No, I'm just kidding, want to make a joke here. No, but of course, the Federal Ministry for Health is also participating within the strategy, because we know that loneliness has an impact on health, but it is not an illness. So this is why it has really a big impact on social connection, and that is why it is in the ministry for the whole society, because we are the ministry for family and senior citizens, women and youth. So, and now let's come to the big goals of our strategy, like what it's ended up. We had 100, we have now 111 measures in our strategy. They are overarching measures and also concrete measures. And 5 big goals, and this is what I just want to stress out now. So we want to raise awareness, I said before. We want to strengthen the research, especially because, as Lara said, we need to know more, especially with the young people. There we do not know which measures, services works the best, what do they need. So we know already a lot, or we can learn more from Krisenchat there, I believe. But this is important because there's not one solution fits all. So it's very different because the topic affects all age groups, as said before. And thirdly, we want to strengthen practitioners. There are so many practitioners, social workers all over, they work on the topic, and we have to bring them together, share their knowledge. And this is why we fund the Kompetenznetz Einsamkeit. It's a loneliness network, and they are the platform for Germany where they bring together associations, civil society actors to talk about it and talk about the services, talk about their knowledge. So strengthen practitioners. And then I said before, acting, the fourth goal, acting across sectors, very important, also with the other ministries. And lastly, of course, to build more on the services for people who are affected already by loneliness, but also to strengthen prevention in this sector, of course. And there are lots of model projects we are funding. And of course, we need to know more about these measures, which works best. And there are already existing a lot of measures for people, like said before, a lot of telephone numbers and other ways. But they need to be more, they need to be like, of course, there need to be lots of more services at a whole, because the problem is, as we know, it cannot be enough. But also, like, the services need to be more easily to access these services.
So handing over to the rest of the panel, what's your reaction? How do you feel if you hear the strategy?
I feel like the strategy is addressing many important issues. Like, for example, the issue that we don't have enough data, as Laura said also before, which is an issue that is hard, because we, for example, in the area of the connection between loneliness and democracy, there is so far mostly our study which has data, but there are not more data gathered, even though we found that there is a large issue which needs to be addressed. But also, when looking at, we just talked about places where people, or where young people don't feel safe, don't feel well. We, for example, don't have any data on why young people don't feel well at school. We know that 60% of lonely young people and I think about the same amount of people who are not lonely, they don't like being at school, but we don't know for what reason. Is it because they don't like the way school is structured? Is it because of the teachers, because of their fellow students? We don't know. So we definitely need more data on it. We, as I stressed before, need more places, not only concrete measures, but also more space for young people to be, to exist, to not have to pay something or do something specifically to be able to stay there, like play in a football team or pay to be there, something like that, where they can just exist and get company. And what is also important is to educate on these issues. We talked about awareness before, but also about the issue of democracy, for example, in our connection of democracy and loneliness, to show that democracy is as complicated as it is, especially in current times, where we have multiple crises. We talked about it before, where we have to have compromise in politics, where it's okay to debate in politics, that all of this is part of the system, that all of this is actually a good part of our system. And we heard before that loneliness and education are connected. So there needs to be an initiative on more education on political topics, as well as the awareness of loneliness.
I really, really appreciate that we finally take this topic into the center and that we have a strategy and that we are working on the topic. And at the same time, I have two hearts. My one heart is a researcher heart, and it says, yeah, we need more research. We need to understand the problem more. And on the other hand, I'm an activist and I see where the need is. And we have so much research already, especially about mental health and the connection between loneliness and mental health and the impact of life. And we still don't have enough capacities, not at all. And I really, really appreciate, I would love to get more action in the whole field. And I would love to get more movement in the real life, what really reaches out for young people. And I really, really want that young people are sitting on the table and can create the solutions and really being involved into finding the right research questions, but also solutions. And I think this is a very structural topic. And when we want to find good solutions for young people, I really think we need them on the table and not just as advisors. We need them as decisioners.
So probably in the words of Lara, 95% untapped opportunities. So in a way, experimenting in the dark with good ideas. How much comes back to civil society there? I spoke with a Hertie student a couple of days ago from India, and he brought in this cultural aspect as well. So for him, like connection to family and so on seems to mean quite a lot. And here in Germany, of course, family is important. But for instance, I with 18, I was gone. And so, of course, a great opportunity and choice that I had. But also in a way, when I come here to Hertie and so on and think, I mean, we're here. Can we create something together in a sense? But so one thing is the policy perspective, but the other one is also the community perspective in a sense. So what do you think about that? I mean, you in a way are a great example of how this could look like, right? Take initiative and so on.
Thank you. But I think everyone can do a little bit. And this is just asking other people how they are, asking neighbors, asking other students, getting in contact and being really interested in the other people in our society is one little step which can have a huge impact for someone to feel, there is someone who's interested in me and there is someone I'm not unimportant for. So I think this is a very, very little step everyone can do in a daily routine, which brings us more together again as a society. And yeah.
This is really important. We say it also very often when we within our raising awareness campaigns, but this is only one side, of course, as you said before. As the federal ministry or the government, we have to do, of course, more and not like yes, please talk to your neighbor and say some nice words. Of course, this is not enough. We know that both things are important. Money.
Certainly, also, especially in these fiscal times, I guess. Yeah.
I guess money is the elephant in the room. But I really want to emphasize what Melanie said before, that we as a society, as a community, obviously we can ask each other how we feel, what we can do for each other. But I want to stress that it's essential to have young people in the room when there are decisions made for young people about the future of young people, about the future of our society and generations. So this is not only in politics, but also in companies. When we're talking about decisions that impact the future, then it's important to also talk to young people who will be affected by these decisions more than we will. And I really want to stress that point.
Probably in that sense, as we have quite a few relatively young people, probably not school young, but at least university young people in the room, I would like to give opportunity now for a Q&A. The idea is to collect 2 questions at a time and then give it to the panel, probably say who you would like to address with a question. I think we have 2 mics, so I'll just pass mine. And yeah, we probably do 2 to 3 rounds, depending on how much interest there is.